The United States spends more on health insurance than any other country in high-income nations in the world. For this reason, I chose the social health insurance system to discuss this week for my paper because I believe that it has the best outcomes for both citizens and for healthcare professionals. Like I said, in the United States, we spend more on health insurance than in any other country in high-income nations, but we continuously have the worst health outcomes of other countries. Moving to a social health care system would be beneficial for both healthcare professionals and for U.S. residents and citizens because it would allow cost reduction and it may potentially lead to an increase in more access to care. As far as costs go, it would reduce costs by allowing citizens to participate in an employer and employee-based healthcare budget. It would require both employers and employees to put funds into a healthcare fund, and then anything that would be left over would be subsidized by the government. This would allow for reduced costs in healthcare, and it would also allow for reduced costs in prescription drugs as well, because the United States, the government would be able to negotiate costs of medications for citizens, and it would help reduce the cost that people are spending on prescription medications by allowing the government to negotiate with drug companies to reduce prices. It would also help reduce administrative costs, which the United States spends a lot of money on. The United States spends more money on administrative costs than other countries, including Canada, and having a social health care system would help reduce those costs. And it would also allow healthcare professionals, such as physicians, to spend less time on administrative tasks like billing insurance and certain notes that would be required for insurance for reimbursement, and it would allow them more time to see patients. In addition to this, it would also, with the cost cutting that it would bring to U.S. citizens, it would allow people to focus more on receiving care because in the United States we spend so much on health insurance. A lot of people are afraid to go to the doctor when there is a concern that they have because they do not think that they'll be able to afford the cost of seeing a physician. So moving to a social health care system where everybody is required to have insurance but the cost is lowered for them would help increase positive health outcomes in patients. One issue that could potentially come up is that the government could say that the cost outweighs the benefit in terms of how much they're spending, especially when it comes to taxes. However, by increasing or by moving to a more social health care system, while at first it might initially cost more, the overall effects would be greater because people are not having to spend as much and they're going to the doctor more. It would reduce costs in the long run for chronic conditions and things like that, especially medications, as well as reducing administrative costs that they would have to face. I modeled the health insurance system after Germany because I lived there for 3 years, and I saw firsthand how their insurance system works, especially being a non-citizen. I was able to be seen at emergency rooms with no cost to me. It did go through my insurance, but I also had my mom who came and stayed with me in Germany, and she got the shingles while she was there, and without health insurance she was able to be seen and written a prescription for under $200. So moving to a social health care system not only allows citizens of the United States to be seen, it would also provide more access to health care for people who are uninsured. 92% of Americans have insurance, but that leaves millions of people without insurance. And so a lot of people do not seek the help that they need because they can't afford it. Having a social health insurance system would help make sure that everybody receives the care and coverage that they need, even if they are not citizens of the United States, which is really important because everybody deserves equal access to care. The health insurance system that we currently have, because it's privatized, it also reduces access to quality care for everybody, and it really prioritizes the health of people who can afford it, and moving to a social health insurance system, even if it is an employer-employee based, requiring people to have insurance or having the government subsidize whatever is left over, would make sure that everybody has equal access to care, and that it is more affordable for everybody, across the board, on a global or on a national level.